Hello, my name is Dr. Michael Bigham. I am the Chief Quality Officer at Akron Children's Hospital and also a pediatric intensive care physician. My conversation to you today comes as one of the key leaders around our COVID-19 response, and I have the chance to discuss a little bit about the COVID-19 vaccine and its prospects for kids age 5 to 11 years old. And so just as recently as this morning, which is Monday, September 20th, there were some public releases of the Pfizer study that specifically looked at the COVID-19 vaccine in kids 5 to 11 years of age. And so I want to take a few minutes to just talk a little bit about that study, talk a little bit about what that might mean for you as a parent or a caregiver of somebody who might be in that 5 to 11 age group, and you've been sort of waiting anxiously for the results of those younger age group studies and what that might mean for you vaccinating your child or the child you care for. And then after I'm done with that, I'll talk for a minute or two about prospects of how one might obtain a vaccine once the full approval is given. So first I'll start talking about the Pfizer vaccine. So there are other COVID-19 vaccines, but the Pfizer vaccine is the one that was most recently submitted for review by the federal government to make some decisions about whether or not that vaccine is the right vaccine for kids 5 to 11. And I think two things are important to know about that vaccine study. Number one, it works. So the vaccine study looked at over 2,600 children, and they gave those kids vaccines, 2 doses, 1 dose and then the second dose 21 days apart, and then they measured their antibody response, or how the body reacted to that vaccine. And what they found was a very robust immune response. And I think the second thing that we should know is they also used a lower dose of vaccine, and so some of us were worried about whether or not that same adult dose would be used in the studies for the younger children, and it's not. They actually used 1/3 of the adult dose in the vaccine study looking at this 5 to 11 age group. And so we now know we've got a vaccine dose that's safe for kids, and we also know we have a vaccine response that's robust for those kids. And so we know these youngsters have been wearing masks, they've been keeping their distance, they've been doing good hand hygiene, and they've really, many of these kids and many of us who care for those kids have been waiting for an alternative or additional solution to protect the health of those children. And we're excited about the prospects of this Pfizer study. So next steps, that study will go to full review, and once that full review by the FDA and others is completed, then there will come a recommendation for that vaccine to be allowed to be used. And so that then, I think, moves us very directly into my second comment, is once we get the full green light, I would say we've gotten the forecast that a green light will be forthcoming once the full approval is granted, or at least the emergency use approval is granted. But then once that full green light is provided, how can a parent get their 5 to 11-year-old vaccinated? And I think that's one of the great opportunities for us here at Akron Children's Hospital, is to be part of the solution. There will be vaccines available across the communities and in pharmacies and in schools, but Akron Children's is really committed to health and wellness of kids in our care and in our communities. And so as a result, we are already planning a multimodal approach to give vaccines to as many of those 5 to 11-year-old kids as we can. Now, I'm going to caution everybody that the day it's approved, we won't be able to vaccinate everybody that wants to be vaccinated. That's just not mathematically possible. But just know that we will have an all-hands-on-deck approach to get as many kiddos vaccinated as quickly as we can in that 5 to 11 age group when that approval is granted. And so we'll be really, really excited and committed to being part of the solution for maintaining the health and wellness of those kids 5 to 11 once that vaccine becomes available. So we look forward to partnering with you, and there'll be lots more communication once that Pfizer 5 to 11 vaccine is approved.